Dear colleagues, I am Christoph Diener from the University of Duisburg-Essen in Germany, and I would like to report studies that were presented at the International Stroke Conference in the United States in February in 2023. Let me start with two studies that were published in the New England Journal of Medicine. Stroke physicians were reluctant to use thrombectomy in people with severe strokes and a large core. Why? There was possibly no benefit and an increased risk of bleeding into the ischemic area. Now, two studies were presented that investigated this research question, and they were both terminated prematurely because thrombectomy was clearly superior to standard of care. The first study was an international study with a 24-hour time window, patients with severe stroke, aspect score 3 to 5, an infarct volume between 70 and 150 milliliters, 180 patients in each group, and there was a clear benefit of thrombectomy in terms of modified ranking scale, and there was no difference in bleeding into the brain. The second study, Angel Aspect, was performed in China, 456 people with large stroke, aspect score 3 to 5, and infarct volume 70 to 100 milliliter. Although this study was terminated prematurely, clear benefit of thrombectomy for modified ranking scale shift, a small increase in bleeding. And this actually means that obviously thrombectomy is effective in a large range of patients with ischemic strokes in a time window of 24 hours. The next study was a study that again compared tenecteplase and alteplase, the TRACE-2 study published in Lancet. I think you all know that tenecteplase is given as a bolus and alteplase is given as an initial bolus followed by a 1-hour infusion. And this study in China randomized 1,031 patients to either tenecteplase or alteplase. After 90 days, there was no difference in modified ranking 0 to 1, which is a perfect or very good recovery, and there was no difference in bleeding complications. The problem is that in many countries, tenecteplase is not approved for the treatment of stroke, and in some countries it's even not available at the moment due to problems with the production of the drug. The next study looked at the possible benefit of a direct thrombin antagonist in people who received thrombolysis with alteplase. Why? The recanalization rate of systemic thrombolysis is only about 40%, and there is a risk of reocclusion of the vessels that was opened by thrombolysis. This study in China had 817 patients with ischemic stroke, time window 4.5 hours, and there was no benefit of adding argatroban to alteplase in people with ischemic stroke, but fortunately there was also no difference in bleeding complications. So the benefit of an additional thrombin antagonist is obviously not there in people with ischemic stroke. Now, there is another very important study which was published in Stroke, and this study was done in the Finnish health registries. And they looked at patients who did not receive a statin after ischemic stroke. The study had almost 60,000 patients, and 27% of these patients did not receive a statin within 90 days after a stroke. And after 1 year and after 12 years, it turned out that the mortality was significantly higher in people who were not treated with a statin, and the rate of recurrent ischemic stroke and cardiovascular events was clearly increased. This is a very strong argument to give statins after ischemic stroke, not only in people who have high cholesterol, but also to people who have normal cholesterol. And the last study, which was studies in stroke, looked at 370 patients with acute ischemic stroke in the early phase and performed cardio-CT, and the investigators found a thrombus in the left atrial appendage or in the left ventricle in about 12% of these patients. There was a higher detection rate in people with atrial fibrillation. Unfortunately, they did not publish the results of coronary angiography in these patients, and they did not perform a comparison with echocardiography. So this means that we basically do not know what is the real benefit of early cardio-CT in people with ischemic stroke. Dear colleagues, ladies and gentlemen, these were interesting studies from the International Stroke Conference in the United States in February 2023. Thank you very much for listening and watching.